Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician. Vaccinations, like any medications, may cause side effects. In this video, I'll explain what are the common reactions that can occur after vaccination and what can be done for those reactions at your home. First thing to do after vaccination is to stay back at doctor's clinic or hospital for at least 15 minutes to make sure if any immediate reaction occurs to get urgent medical help by the doctor, because most of the reactions occurs within 15 minutes following vaccination. Coming to the common reactions, most vaccine reactions as explained by your doctor are very minor events and are usually mild and short lasting, and most of the instances these do not need any special treatment. First thing parents are always worried is about the local reaction, that is swelling or redness around the injection site. This swelling is most commonly seen with DPT vaccines, which are given in 6, 10, 14 weeks and very rarely seen with other vaccines. If such swelling happens, keep giving massage at the injection site at least 3 or more times in a day. And the next thing you can do is applying heat, because this will increase the blood flow to the area and decrease the pain and swelling. To do it, use an electric pad or a warm cloth for at least 10 minutes and repeat as needed. If you prefer, you can also apply cold, but avoid direct contact of the skin with ice. To do it the right way, take an ice cube and rub it over your palms. Apply this cold icy water on the affected area with your palms by gently patting on the injection site. When your baby feels a little comfortable with the cold sensation, wrap an ice cube in a clean cloth and apply it over the area. Do this at least 2 or 3 times in a day. My dear parents, remember, directly rubbing an ice cube on your baby's skin, which is already inflamed, can make the experience more painful than providing any relief. So, please avoid direct contact of ice cubes with your baby's skin. The next thing is medicine for pain. Try not to give any medicine because this may reduce the body's normal immune response. Vaccination pain very rarely becomes severe, and if really needed, use paracetamol as per your doctor's advice. Now, we will see what to do if your child develops mild temperature or fever. First thing is to monitor the temperature with a thermometer. Temperature above 38.5 degrees Celsius or 100.4 Fahrenheit is only called as fever. Once your child develops fever, keep them cool by not overdressing and make them drink more fluids. You can also do sponging with lukewarm water, but giving cold baths and cold showers are not recommended during fever. You can use paracetamol as needed every 5 to 6 hours once as per your doctor's dosage advised. Now, I'll explain what to do if your child develops behavioral changes such as irritability, decreased appetite, and excessive sleepiness. Some children sleep more than usual after vaccination, and a decreased appetite and activity level are also common after vaccinations. These symptoms are very normal and they do not need any treatment. They will usually go away in 24 to 48 hours. But if these symptoms do not resolve or if you are concerned, please contact your doctor. Next common reactions seen are vomiting and diarrhea. Usually the fear of vaccination will make the child vomit, and this does not need any specific treatment. And sometimes diarrhea can also be seen after rotavirus vaccination, and this is self-limited, it will come down on its own. Fainting is uncommon but sometimes can be seen in children who are frightened by the vaccination procedure. And even lightheadedness or giddiness is also seen, and if this happens, make the child lie down for a few minutes. Now, we will see what to do if your child develops any rare or severe reactions after vaccination. The worst thing to happen is a convulsion or a fits after vaccination. Some children are more prone to seizures or fits when experiencing a high fever. The seizure usually lasts around 20 seconds and very rarely more than 2 minutes. If a child experiences a seizure following vaccination, they should be compulsorily taken to the hospital on emergency basis. The next one is anaphylaxis. It's nothing but a severe allergic reaction. This can occur suddenly and usually within first 15 minutes. However, sometimes this can occur several hours after vaccine administration. Early signs of this anaphylaxis include redness and itching of the skin and sudden appearance of swelling all over the body, and breathing difficulties and a sense of distress in your child. If this happens, immediately rush to the hospital. Now, I'll tell the red flag symptoms after vaccination, and if your child has any of these, immediately take them to your nearest doctor. Crying non-stop that lasts more than 3 hours, and vomiting or severe crying followed by rotavirus vaccination, and if your child looks or acts very sick. Fever in a baby less than 12 weeks old and fever above 104 degrees Fahrenheit. Redness around the vaccine site becomes larger and more painful to touch after 3 days, and if the fever lasts more than 3 days. Fever returns after being gone more than 24 hours, and measles vaccine rash that lasts for more than 4 days. If you have any of these symptoms, please rush to the hospital. This is all about the post-vaccination care at home, and if you have any further queries, please do ask in the comment section. And last but not least, don't forget to subscribe my channel and share my videos. And thanks for watching.